Speak sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Pickleball eye injuries surge in US. Breaking number 148. The surging popularity of pickleball has brought with it a concerning increase in eye injuries among players. Pickleball-related eye injuries rose by more than 400 cases a year from 2021 to 2024, up from around 200 annually during the prior decade, researchers reported October 16 in JAMA Ophthalmology. Some players took a direct hit from a ball, while others received their eye injury during a fall or from being whacked by a paddle, researchers found. This increase occurred even as eye injuries in other sports like tennis, baseball and basketball have been declining, researchers noted. Players 50 and older had a higher risk of receiving an eye injury than younger players, the study found. Number 156, we've seen a lot more players who are not familiar with the sport entering the court, and that creates a lot of opportunity for injury. And number 157, senior researcher Dr. Jonathan Suey, a professor at Rutgers New Jersey Medical School in Newark, told the New York Times. Number 156, they're not used to how fast the projectiles are moving and how close to the other players on the court they are. And number 157, Suey said. For the study, researchers analyzed injury data kept by the U.S. Consumer Product Safety Commission. Between 2005 and 2024, there were an estimated 3,112 pickleball-related eye injuries in the U.S., with 1,262 of them occurring in 2024 alone, researchers reported. The number of injuries is nowhere near the 19.8 million players estimated to have taken up pickleball in the U.S., but represent a need for wearing eye protection while playing, researchers said. Some players were hit hard enough to detach their retina, break bones around their eye socket or rupture their eye, the study found. Others walked away with a black eye or a cut. About 43% of injuries involved a direct hit from the ball, 28%, falls, and 12%, a hit from a paddle, the study says. People 50 and older had a 39% higher risk of an eye injury than younger folks. Researchers noted that USA Pickleball in 2024 turned down a rule change that would have required players to wear eye protection in tournaments, citing the challenges of enforcing the rule. USA Pickleball also has not offered any guidance on IP less than /speak protection, researchers said, and many pickleball clubs and recreation centers have no such requirements. Last year, actress Michelle Pfeiffer and journalist Savannah Guthrie proudly displayed their pickleball-related eye injuries, said Dr. Matthew Gorski, an ophthalmologist at Northwell Health in Patchogue, New York. I think it was very important that they were spreading awareness of the potential dangers for pickleball and the real importance for wearing eye protection while playing pickleball, and number 157, he added in a news release. Gorski, who was not part of the study, said he wasn't surprised that older folks are more apt to become injured playing pickleball. Number 156, people over 50 in general are often more susceptible to injuries with any type of sport, and number 157, he said. And number 156, many older patients are not as agile to avoid trauma or contact from a ball or paddle or have pre-existing eye diseases that would put them at higher risk for a significant eye injury. And number 157. Gorski recommends that players buy wraparound eye guards that meet the American Society for Testing and Materials F3164 standard for protective eyewear. Number 156, it's really important to have the correct material. Typically, we think of a polycarbonate type of plastic that would provide adequate protection in case of some sort of trauma, and number 157, Gorski said. And number 156, it's always important to speak with your eye doctor to make sure that you're wearing eye protection that is appropriate for the type of sport that you're playing. And number 157. Source is JAMA Ophthalmology, October 16, 2025. Northwell Health, news release, October 16, 2025. The New York Times, October 16, 2025. Break disclaimer: statistical data in medical articles provide general trends and do not pertain to individuals. Individual factors can vary greatly. Always seek personalized medical advice for individual healthcare decisions. Break and copy, 2025 Health Day. All rights reserved. Break ad as a preferred source on Google. More news resources for MedWatch. Drug alerts daily. Med news. News for health professionals. New drug approvals. New drug applications. Drug shortages. Clinical trial results. Generic drug approvals. Subscribe to our newsletter. Break whatever your topic of interest. Subscribe to our newsletters to get the best of drugs.com in your inbox. rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs. Less than /speak.